Hello everyone, welcome to today's presentation. In this presentation, you will learn how to pass the ANCC exam. I will go over each domain in details. And thank you for tuning in. Major domains of the exam include the exam components. Major competency domains, clinical and ethical focus. The exam components include 175 questions. 150 of those will be scored. 25 of them is not scored, but it includes exam so they can know how the people do, if they are easy or hard, so they can adjust it later. Okay. Major competency domains are scientific foundation, assessment, planning of care, psychotherapy, evaluation of the treatment, ethics, and cultural competency, clinical and ethical focus. This domain is emphasize a clinical reasoning, evidence-based practice, patient-centered care, cultural sensitivity, and ethical practice. Preparation strategy include we should focus on high-weight domains and practice case-based questions to improve exam score. Core knowledge areas. Core knowledge areas are heavy and important. It includes advanced pathology. It goes over complex disease processes, their treatment, symptoms, and then there is advanced pharmacology, which goes over drug interaction, adverse effects. Also, there is a psychopharmacology, which goes over symptoms, psychopharmacology symptoms such as EBS, NMS, pharmacokinetics, how to choose the best drug, how to assess when you prescribe the medication, how you choose which one is best, how to follow up, how to assess the symptoms, how to educate the patient, and the neurodevelopment, brain development stages, and the psychogenomics, gene and drug interaction. So this area is heavy and there's a lot of parts to know. We will go over each part separately later in the channel. Comprehensive psychiatric evaluation. Skills will include clinical interviewing. Example will be open-ended questions, motivation interviewing, mental health screening, such as using the PHQ-9. for the depression. GAD 7. Vanderbilt ADHD. Other skills are emergency management, suicidal ideation protocols to use, substance usage screening like ADAT, DAST, Kiwa, COWS, which is drug withdrawal, alcohol withdrawal. So we are going to study this each separately. Treatment strategy and collaborative care. Component will be diagnostic criteria, DSM-5, TR standards. Evidence-based practice, such as medication dosing, psychotherapy selection, and then the other one will be management. We are going to manage the psychotherapy, pharmacotherapy, and pharmacotherapy monitoring. Therapeutic approaches and changing models. What are the theory we are going to use? The theory that we are going to apply are cognitive behavior therapy to manage the anxiety and depression, theoretical model, which are going to apply stages of changing in addiction recovery, family therapy, the structure of the family, narrative therapy. We are going to use these approaches, theoretical approaches, and change models. For the treatment outcomes and effectiveness, depression severity assessment, we are going to use BHQ-9. Anxiety severity assessment, we are going to use GAD-7. Alcohol withdrawal monitoring and assessment, we are going to use Kiwa, or we are going to use MINUS. Legal principles, diversity awareness. Ethical principles include informed consent. We are going to educate the patient to go over the procedure or the treatment, and then they will sign informed consent. Confidentiality. HIPAA, we are going to educate the patient for their rights. And then cultural competency include addressing the belief system, patient belief, family belief, individual belief, group beliefs, and then social determinants of health, like housing, shelter, homeless, patient social determinants of health, and how they evaluate or how they follow up their treatment. Advocacy, we are going to educate the patient, we are going to accommodate their needs. Key factors for the exam success include studying the neurotransmitters like serotonin, dopamine, gabapentin. We will go over each of them. Brain structure, limbic system, frontal cortex. Those will be the exams, but there's a lot parts to go over. Risk evaluation include the suicidal ideation, violence, substance abuse, legal principles, HIPAA, confidentiality, informed consent. Those are the key factors for the exams. Each of them we are going to study and go over in details. Domain, weights, and focus areas. As you can see clearly, advanced practice skills is where the most questions are coming from. Diagnosis and treatment will be the second area where the most questions are coming from. Scientific foundation will be the third areas. So, how are we going to pass the exam? The way we are going to pass the exam is study those areas. Put all your energy, all your focus, all your time and effort in these three areas first. Memorize it, highlight it, make a flashcard, whatever works for you. Study these areas. Then go to the last percentage, like psychotherapy, cultural care, and ethical. Know what include each areas. This slide is just the outline, but for each area has a chapter its own. It has different assessment tools, different screening tools. That is the advanced practice skills. Treatment and diagnosis. Know the DSM-5 diagnostic, psychiatric diagnosis manual. Know how to look for the symptoms for each disease. Use the evidence-based practice. What diagnosis you have to, with diagnosis tools you have to use, what treatment is recommended, and then scientific foundation. Memorize the neuroanatomy, pharmacology, and then that will help us get the most questions correct. When you memorize or study the most percentage, where the most questions are coming from, and then less question is put less time and less effort. That way will help you to pass the exam. Each month and weeks, I will concentrate each areas, and I am going to post the videos, lectures explaining each areas to help us pass the exam. Thank you for tuning in today and watch those videos, and please subscribe. Thank you.